Pregnancy during the coronavirus pandemic. During this pandemic, pregnant women need special care. Therefore, dispensing with ignorance and embracing knowledge about the current scenario becomes the first priority. COVID-19 is the illness caused by the novel coronavirus SARS-CoV-2. This coronavirus infection affects the respiratory tract. The brief issued by AMOGS, which is the Association of Obstetric and Gynecological Societies of Maharashtra, outlines this possible specific impact of this infection on pregnant women given their unique requirements as well as the needs of their unborn or newborn babies. In many cases, we are dealing with twins due to assisted fertility programs like IVF, ICSI, etc. Evolving guidelines on COVID-19 are dependent on current knowledge and experience of the medical fraternity from across the world. Owing to the evolving nature of the data and the lack of sufficient information, these recommendations and guidelines will also evolve and subsequent updates will be issued based on updated information. Specific recommendations for pre-childbirth, during delivery, and post-childbirth care have been issued by associations like the AMOGS and FOXA. They are likely to be updated as our understanding and experience deepens. Patients must understand this and while following these guidelines must temper them with the latest regulations and updates available. Respiratory infections are a real concern in pregnancy during COVID-19. COVID-19 severely affects the respiratory system in pregnant women. We know that even under normal circumstances, pneumonia is an important cause of maternal morbidity and mortality. This is because physiologic changes that occur in pregnancy lead to natural suppression of the body's immunity, which means that a simple cold or flu infection can lead to lung infection manifesting into pneumonia. It is a good idea to reduce the pregnant woman's exposure by restricting scanning and checkups to the bare minimum necessary. Her risk during traveling and exposure at the USG clinic needs to be considered seriously. If pregnancy is confirmed, fetal monitoring of confirmed COVID-19 mothers ought to happen month to month. Fetal ultrasound appraisal should be performed to check for any abnormality in development and anatomy. To reduce traveling and exposure at the USG clinic, scans may be restricted to the 12th, 20th, and 32nd week as currently recommended by the health authorities. The first question that is likely to be asked is, do I need to be tested for COVID-19 if I exhibit symptoms? Should you be experiencing fever greater than 100 degrees Fahrenheit or 38 degrees centigrade and or difficulty in breathing and or cough, you should immediately consult your obstetrician. This can be done online now. Based on your symptoms and travel or contact history, you may be advised to get tested for COVID-19 or other tests may also be prescribed. What if I test negative for the coronavirus infection? If symptomatic but negative, you will be required to home quarantine and resume antenatal care after 14 days of being symptom free. If self-quarantined and if antenatal care cannot be delayed, alternate arrangements should be organized in the discussion with the medical team. Fortunately, with available communication technology and consent of the medical council, avenues like telemedicine, online consultation, video calling, etc. are ways to keep in touch with the treatment providers. What if a pregnant woman tests positive for the coronavirus? Do not panic. You may have to get admitted for isolation and treatment at a facility specified by the local health authorities specifically for pregnant patients. Thank you. Stay safe. Wishful, Tejashful.